We are at the second day of the webinar titled Numbers That Heal, the Role of Biostatistics in Medicine and Research. Today we have Dr. Harini Srinivasan with us to deliver a talk on the role of biostatistics in modern healthcare. In fact, now it's midnight there at New Zealand, exactly 12:30 a.m. I think. I thank Harini for her support, and on behalf of all gathered here, I extend a warm welcome to Dr. Harini to the webinar. Gautami, please.
Yes, sir. So once again, welcome to the second day of the webinar on numbers that heal, the role of biostatistics in medicine and research. It's my privilege to introduce our today's resource person, Ms. Harini Srinivasan, a seasoned data scientist currently working with the Health Quality and Safety Commission in Wellington, New Zealand. Ms. Harini brings with her over 8 years of diverse experience in the field of data analytics, having successfully undertaken roles in both on-site and offshore environments. Her expertise spans a broad spectrum of statistical modeling and data visualization with a specialized focus on the healthcare sector. At the Health Quality and Safety Commission, she plays a vital role in supporting infection prevention and control, IPC analytics, contributing to the enhancement of public health outcomes through insightful data-driven strategies. On behalf of the organizing committee and all the participants out there, I welcome you, ma'am, to proceed with the session.
Thank you, Sajesh, and thank you, Gautami. So, I'll start sharing my screen and not waste time, and I can go ahead. So, let me share my screen. Yeah. Okay, I think now you should be able to look out. Yeah.
Yes, ma'am. Yes.
Yeah. So now, what I would love to start is the role of biostatistics in healthcare. So the major thing is like why I really wanted to, concentrate on this topic is, see, we have been taught with so many theoretical other things and everything, but I thought this is the most important thing we need to emphasize students, what exactly is happening. First of all, before I begin, I just wanted to share something very personal. It's like, I know like if there is going to be some disturbances from my kids or something with the noise, please excuse me. I hope like it doesn't happen, but still just wanted to request. But anyway, I was so excited for this session so that I didn't want to miss the opportunity. So that's why I told Sajesh sir, okay, I can do it in the evening your time. And big thank you to Sajesh sir and all the, all the members of the research department of statistics for inviting me to speak with all of you today. And thank for the brief introduction, Gautami. So this is like I'm just connecting back to my own. I just wanted to extend like what I did in my doctoral work. So probably like you all can get think like why I've chosen this topic. So my doctoral work was basically focusing on predictive modeling diabetes, especially like studying the length of stay in hospitals. So my journey has taken me from the classroom to hospitals, dashboards, and research publications. So to briefly introduce my professional background, as she told, like I am more emphasized, transforming those numbers into mere stories. So that's really, I really wanted to emphasize for this session. Okay, let me get into, what is this biostatistics? So I know like everyone knows what is biostatistics and everything, but the only thing which I think like people might be missing is it is used in most of the things, But one thing which I really wanted to say is it is one of the applications to the biological problems, especially in healthcare. It helps us to make sense of complex health data, enabling better research, diagnosis, and health system management. It turns the numbers into actionable insights. So why this biostatistics is very, very important? So it's going to bring an objective to a healthcare decisions, whether you're studying a treatment of effectiveness or designing a new public health campaign. So the biostatistics is going to ensure you're basing your actions on data rather than assumptions. So that's why it's going to be like an evidence-based decision making, and which intends going to improve your patient care and safety, which is one of the most important aspects of any healthcare across the world. So that's why this is going to be more important. And then comes like the clinical research and applications. So what is this clinical research and applications? I know like you had a kind of a session yesterday to know like what exactly happens in a kind of a clinical trials and everything. So just to extend to it, here biostatistics is going to help us to test the hypothesis scientifically. One of the best example I can give you is the Covaxin trial, which we really did in India. Do you think like how the trial happened? It's only because of the biostatisticians. You know, the biostatisticians helped to decide how many participants were needed. They randomized them and analyzed the side effects and how effective Covaxin is. So without this, we wouldn't have the safe vaccines at all. So that's the other one of the important things where the biostatistics have played a very, very crucial role. So the sample size, the power analysis, I know these are some of the technical details and definitions which you have studied in your sampling paper, but I wanted to emphasize those are some of the important factors which is going to drive away the clinical research trials. And then comes like, I wanted to mention like those two important Covaxin and Covishield trials, which everyone will be aware of. So that's why I really wanted to, you know, emphasize what it is. And let me go to the next one. The next one is going to be the how these are, you know, transformed in a kind of an application thing. So one of the thing what a biostatisticians and a biostatistics is actually driving away is disease surveillance and outbreak tracing. And then you have an idea of supporting as a biostatistician for many health programs. And like one of the example is, I can give you from your state, Kerala, where they use the predictive modeling during COVID-19 to plan for beds, oxygen, and ICU support. And one of the keynote is like they try to, you know, powers the public health by turning the health records into a strategy. So, for example, they use the statistical modeling to anticipate the needs, and they gather weekly disease data to detect the outbreaks early and respond how much fast they could do. So those were something very interesting key things like a dashboard they definitely had. I can walk through that later. But now, like, I just wanted to say from like what's happening across your thing. And then if I come to like in biostatistics in hospital management. So what happens here? So the hospitals use these biostatistics to improve the resource use and outcomes. So if you take an example, AIMS, so they are using like, they use the biostatistic tool for what? They wanted to improve the efficiency and reduce the infections so that the healthcare associated infections are lower. So it is good for a country where infection is very less, so that, it doesn't spread and quality care of the patients increases. So that's the main intention. So in hospital, the biostatistics is used for managing resources like forecasting how many ICU beds are needed or reducing infection rates. So they can use the statistical analysis to monitor the surgical outcomes. So when there is a surgery inside an hospital, and obviously they say like patient may have a kind of an infection, you need to keep an eye, so you need to reduce the to reduce the complication for the patient, you have to have the outcome like the infections to be very, very, very minimal. So that's going to be one of the key factor. So they try to analyze the surgical complications and streamline the ICU management. So that's one of the key thing behind our kind of a statistical thing. So these are some brief idea to give you a framework how our biostatisticians can make a difference in an hospital, in healthcare resources, not only in analysis but also on the front end. So now just get I shall get into more technical details like how what are the key tools and techniques, something like that. Okay, so this is where the main picture begins. So that's going to be the key tools and techniques. So what happens in the key tools and techniques? So let me touch the tools of the biostatistics. Let's start from the basic averages to complex regression models. So what happens? These techniques will allow us to analyze everything from, effectiveness of the vaccine to even like in cancer survival rates. For instance, like survival analysis is being like a key in a cancer research to estimate how long a patient might live after a certain treatment. So let's start with two broad categories from descriptive and inferential statistics. I know most of you are aware like what is descriptive statistics. It's just like a snapshot of what the data is sitting in. It can be like mean, median, standard deviation, and percentage. So we just think like, oh, we can use all these things, but certainly we cannot use mean always. Okay, so and of course the same wise with a median. When it's going to be like in skewed data, then obviously you have to emphasize on median rather than mean. So that's where like biostatistician makes a vast difference. So in healthcare, you might describe the average length of hospital stay, distribution of a patient ages, or a gender breakdown in a study population. And that can be like, descriptive statistics can be done with a number and also by a visual depiction. So it is the biostatistician who have to break down and say like which can be used at what time. Not always a kind of an complicated chart. Even a simple bar chart might infer a lot when it's going to come to a public domain. So that's what is the key findings and the work of the backbone of any of the biostatisticians. But like descriptive statistics is just going to tell you what's happening in your sample. If you really want to go behind that, you need to look out the questions like, is this trend real? Could it have happened by any chance? Will it happen again in a different populations? So that's where the inferential statistics plays a vital role. So for example, you can collect the data on a recovery rates after a surgery in a Trivandrum Medical College, and then you can use the inferential stats, and we can test if those recovery rates would be something similar in another hospital like Kozhikode Medical College, or if the difference we observe are statistically significant. So this is where the inferential statistics come in picture. And then we have got the what's that called, t-test, chi-square, and ANOVA. So You might be wondering, like, with a simple example in your classroom, but I wanted to extend like inferential tools with some of the classic tests we often hear about is the t-test, where you compare the means between two groups. For example, if there is a healthcare company where a new drug is into testing, where it says like the new drug lower the blood pressure more effectively than the standard treatment, we can run a t-test to compare the average BP values. And then similarly, if it's going to be chi-square is one of the great thing for categorical data, to check whether there's an association between the vaccination status and COVID-19 infection rates in a population. I think that might, I'm taking this COVID example is because like it's easy for everyone to understand because everyone knows what happened. And then comes the analysis of variance, ANOVA. That takes the step further. So what happens? It allows us to compare more than two groups. Think about a scenario where you're going to compare your HP levels, the hemoglobin levels across, three dietary groups. Like if you take for a vegetarian or a non-vegetarian, and there's another one which is, very common is like a vegan where they don't take any kind of meat products. Like in that case, like ANOVA is going to help us to test whether these means are going to differ significantly. All these tests assume certain conditions. So choose the right one depends upon your data type, your sample size, and most importantly, what is your research question, research objective. So those are the three things which determine you to take which test you need to go ahead. So these tests help the researchers understand if differences observed in data are statistically significant or due to chance. And then comes the regression and survival analysis. So now we move into most important and most talking term in almost in all social media and everything. That's going to be the predictive modeling. So what happens? Why you see like the regression analysis is more powerful? Because where you will be able to help understand the relationship between the variables, adjust for the confounders, predict the outcomes. So, for example, if you take a logistic regression, you might predict the likelihood of developing an hypertension based on factors like age, BMI, smoking status, gender, etc. And then like you can have a linear regression. What's that's going to estimate? It's going to estimate like how much a person's systolic BP is going to increase with each unit increase in a BMI. Quite interesting, right? You can have a logistic regression, a linear regression. And if you take like, for example, in Kerala's health context, I can give you an example, like to model how social economic status affects the access to maternal health services. And this is where the regression plays a vital role, where you have got a logistic regression, you've got a multivariable analysis, you have a linear regression, you can pick up like whatever is suitable again for your data based on your objective. So that drives a key force, what kind of a model you're going to work on. And then comes the survival analysis. That's going to predominantly focus on time to event data. If time and event data, you are going to focus like time until readmission or time until death, the most important thing which drives you away is going to be the survival analysis. I know like a Kaplan-Meier curve that will help you to visualize survival probabilities of patients with different cancer types. And then you have got the Cox proportional hazard model that is going to identify what are the factors that significantly affect the patient survival. And like a survival analysis might reveal that older age and delayed diagnosis is going to reduce survival chance in TB patient. This was, I could find it out from an internet, like this was a small study which is done in Kochi, one of the hospital. So that's why I just wanted to cite an example, like how things have been used widely. And then comes the meta-analysis. So the meta-analysis is for combining studies. So this is in an evidence-based medicine. We often have multiple studies on a topic. Okay, so like I might be doing a study on a particular topic, and then another hospital might be doing, and several districts, hospitals might be doing that within different results. Then for when there is going to be different districts with different results, and we want to represent like for a state, how do we make sense of them? That's where the meta-analysis comes in it. So statistically, you're going to combine the results of several studies, and that is going to increase your statistical power. And other one example is all the state have got their results, and when India wanted to put them on their dashboard or something in their site, like, oh, this is what is happening, then obviously, like, the meta-analysis is going to be the key thing. And that's going to have a kind of a generalizable conclusion for COVID, like when it's going to be a global pandemic and all the countries across is watching on you. They doesn't only focus on one particular state, they focus like what India is doing. So that's what I try to say. It's like a generalizable conclusion. For instance, if multiple small studies, that's what in Indian states look at effectiveness of iron supplementation in adolescents, meta-analysis could pool these findings to understand the overall effect. It's particularly useful when individual studies have gotten conflicting results, like the Cochrane collaboration and Indian Council of Medical Research often rely on these kind of meta-analysis to inform the national guidelines. So tools like forest plots, they are one of the examples to visualize these findings, and they often, guide the policymakers in resource allocation, treatment recommendations, and prioritizing the interventions. So these are certain examples, the key tools and techniques, which is predominantly used in, biostatistics. And then comes the okay, so in this modern world, this is another key thing. So you might, by looking at this, why have I striped that SPSS and Stata? I will come to that at the end of the slide. So let's look at these tools that make all this analysis possible. So there are certainly some of the most commonly used statistical software in biostatistics and health analytics are. I know like this is going to be a free open source programming language, and this is heavily and widely used in biostatistics and epidemiology. It is especially popular in academic and public healthcare research, and many institutes I personally know like ICMR, AIMS are now training students and staff in R. So it's a great, it's like a great one for custom visualizations, reproducible reports, and also for an, advanced modeling. And SAS. This is again the, it's going to be one of the fanciest thing when you go to any kind of a clinical trial or a pharmaceutical industry. So it has the FDA acceptance in many clinical studies, and it's mostly and widely used by most of the pharmaceutical industries across. And there is a lot of companies in USA, like where SAS, if you know really good SAS, then you get a lot of exposure to most of the clinical trials. One of the few things like companies like Dr. Reddy's, Cipla, so they all have the regulatory compliance, and SAS is one of the predominantly used one. And it's known for the data security and scalability, especially when it's going to be with large data sets. And yeah, So the SPSS and STATA, I know it is an kind of an entry level for all the graduate students across any kind of in the southern region of India. So we predominantly use these software because it's quite easy and user friendly for any of the students to first understand how to do it in a software. So it's most popular for the beginners and researchers, and it's based on survey-based and public health studies. It's most common only in Indian academic institutions, but when you come out of these kind of institutions, I don't think SPSS and STATA are predominantly rolling out in most of the organizations. So that's why I really wanted to put up things more clearly, like what you have to focus more, like R, SAS, and Python, SPSS, and STATA. They are a bit straightforward, where you don't need require any kind of coding skills. And then like STATA, so they are if you really wanted to have something in kind of an econometrics, then probably like a World Bank or World Health Organizations or any banking sector, STATA is a little bit used over there. But I could say like these two doesn't give you more exposure to coding, but R, SAS, and Python, I think you can develop your skills more on this. Because most of the companies, when you are recruited, expect you to have a kind of customized visualization, and the data sets are going to be a very large one. So obviously, and of course, the license value for SPSS STATA is going to be higher, and of course, the same applies for SAS. But R and Python are going to be, one of the open software, open source programming, and you can have your own kind of libraries, and you can have your own package developed. So those are some interesting things which I really wanted to highlight for the graduates and the postgraduate students. Python, I know like it's one of the rapidly gaining popularity, especially when you're going to deal with some advanced analytics, machine learning, and most important key term is the artificial intelligence for the integrations. So that is playing a vital role. So hospitals with something like an advanced health IT systems, or even startups like health tech, they use Python to predict like patient readmissions, optimizing the diagnostics, or automate any data pipeline. So that's where like it helps. So again, the key thing like in healthcare industry is like you can have like any hospital can have their own data set, which will provide you kind of an information like a person having the surgery. Okay. For example, let's take, for example, a patient having a kidney transplant. What is the chance of predicting the patient readmission? So in that case, you have a testing and a training model, and based on that, you can automate the pipelines. Like, okay, so moving on, I think like if the patient is discharged even before a week, then probably like the readmissions rates are higher. So probably we have to keep the patient at least for 10 days so that the readmissions are less. So this is like a big example which I wanted to highlight. So those things, those models can only be used widely in healthcare organization. That will be really helpful for the management perspective. And then like as I was saying, like some of the things which I wanted to again focus is the key analytical techniques, which I was saying previous slide, the logistic regression, survival analysis, and then like time series and forecasting. So logistic regression, just like a quick thing, how it's really used in real world healthcare settings. So this is used when your outcome is going to be binary, like yes or no, disease or no disease, COVID or no COVID, alive or dead. So these are certain examples for the, like cancer or non-cancer, success or not success. So those all comes into logistic regression. So it's crucial in disease prediction models. It could help predict whether a patient will develop complication after the surgery based on certain factors like age, comorbidities, and then like some predefined infections he has got, or a preoperative indicator, something. So I think like these are something very important, and logistic regression might be used to study factors associated with non-communicable diseases like diabetes. And that's where like logistic regression is predominantly used. And it's one of the easiest one to do it. And then for the survival analysis, as I told, like how it's widely used in cancer studies, HIV treatment monitoring, and hospital readmission analysis. In Indian hospital setting, if you really wanted to look like survival analysis, it can be used to evaluate the post-surgery survival rates based on the procedure type or based on the patient history, what they are doing. Yeah. And then it comes the time series and forecasting. I think I didn't talk much brief about this in my previous slide. So I just wanted to say like this is used to model. Of course, the time series forecasting is also like in predicting the regression modeling, but in a little bit of change. This is used to model and predict the future trends based on the data which you added, historical data. So it's like modeling and predicting the future based on your past data. So if you take healthcare, it is useful for predicting the inflow of the patients or outflow of the patients, occupancy in ICU or seasonal outbreaks like dengue or flu or malaria. So the government hospitals might use the time series forecasting to anticipate the peak demand during monsoon-related disease season or any outbreaks. So these techniques aren't just academic, they directly support the resource planning, then clinical decision-making and policy designs. So the ministers of the state, they predominantly use the forecasting and they get ready only based on these time series forecasting. And that's how they react based on these things. That's why I wanted to emphasize how they are, predominantly used. Then comes the real world case studies. So when you have the real world case studies, so what happens? So NFHS, that's going to be the National Family Health Survey. It's one of the most India's comprehensive sources of maternal and child health statistics. It's conducted every few years, and you're going to provide a state-wise, district-wise data. Example, like you can go to the website and you can find it, but I'm just giving you like some typical examples for which can be like in future reference if you're going to do some projects or for a research paper. So for example, the percentage of institutional deliveries, prevalence of anemia among the women and children, immunization rates among children under 5. So the biostatistician is going to play a major role in designing the survey, analyzing the data, and informing the public health policies. One of few of them is going to be like a Janni Suraksha Yojana, Poshan Abhiyan. So these are something health policies, and these are framed based on these. So again, if you take your state, Kerala, so the National Family Health Survey data helps to evaluate success in areas, especially like antenatal care coverage and exclusive breastfeeding rates. So Kerala is with an higher figure, so where you could go and check the numbers. And then comes the ICMR. So I know like it's going to be Indian Council for Medical Research, and especially if you take the Cancer Registry Network, where it's going to manage the National Cancer Registry Program. So it collects the data from 30 populations and hospital-based registries. It tries to, it is going to help to understand the incidence of cancers, survival, and trend across India, not only a particular district, but across, India. For instance, Kerala has consistently reported higher incidence of breast cancer, especially in urban areas. So using these biostatistical methods like 8 standardized incidence rates, ICMR tracks long-term trends and evaluates the impact of the screening program and awareness campaign. So these are something, it's not only used mere the purpose of the data, but these data helps for for a country to emphasize more programs and planning to reduce the diseases or reduce the infections or reduces any certain things which is happening. So that's why like you have got a lot of funding from the for the people under the urban or rurality based on the salary and everything for the and a person above 40 years, you can go do the screening programs, especially if they are prone to some conditions. So I think like these are something very, very important. And the other thing which I really wanted to share is going to be like the Kerala COVID-19 dashboard. I am not sure, and if um, everyone is aware about the dashboard, I'm happy, but it is one of the interesting things which I really like it. So Kerala is one of the first Indian state to develop that public COVID-19 dashboard during the pandemic. So what they have used is Power BI. It's like, there will be a real-time data that's going to be powered by the biostatistical model and visualization to inform district level case counts, the hospital bed availability, and trends and testing and recovery. So biostatisticians and data scientists have collaborated with the government to predict the case surge using these time series models. And they estimated the reproduction numbers, they tracked the case fatality rates over time. And this transparency and the data driven decision making are one of the key thing in Kerala's early pandemic success, and I think like it earned international recognition too. So I could quickly share the website to just to show you more like what it is. Are you able to look out the dashboards, right? So just look like it's from the Kerala. They have started, you could see like they stopped on 2022 because since the daily reporting of the COVID cases in the state has become very less, the daily update of the dashboard is discontinued. But like how you can go and look how the dashboard is built, and you can find for all the Kerala districts like which one has got the peak one, Thrissur, like latest quarantine cases, where was the active cases, and you can find it in each of the districts. And like you can find out the peak when it was in peak. So it was somewhere in between July, and then again it went to 55K in January, and then the new cases, and it completely declined. And the same thing you can find out in this model. So these are something which I really wanted to show you how the government has implemented this dashboard, and you can look out for what district it is. Somehow it's a little bit late. So if you take, for example, Idiki, and you can click it, and you can find only the Idiki data. So this is something which is built in Power BI, and you can see like what is the confirmed cases, what is the active cases, how many of them were cured, how many deaths were happening, and you can find the trend. And then this was something like in date-wise, the cumulative cases reported active. Yeah, and you can find the numbers like what is the quarantine and what is the latest active. So so this is one of the interesting thing, and it really took a lot of global attention. So what I thought was I just thought of bringing it to your attention, so you can go play around. Like if you wanted to create some project work, probably like this is the data set where you can go and look in, and how they have built these things. You can typically do them. Let me go back to the slide. Okay. Okay, so the next one, which I really wanted to say, is the career pathways. Yeah, so I know like few of them, you might be interested to work after your undergraduation or graduate post graduation. Of course, uh, everyone cannot become a professor or a researcher, so you have to fit in some organization. So let's take a moment to explore the career pathways available for the trained biostatistics, epidemiologists, and data analytics. So I am not saying in a global thing. I wanted to, within the Indian healthcare ecosystem, I'm trying to fit in. So biostatistician is the one who is going to use the statistical techniques to design studies, analyze the health data, and guide the public health decisions. And then their vital role will be like a clinical trial, the health surveys, policy evaluation. In India, as I showed you in the previous slide, biostatisticians are employed by the ICMR, um, Indian Council of Medical Research, so especially in disease surveillance and clinical research. And then you have got AIMS and other government medical colleges. They often have the research units. And of course, the state health departments. So they've got the data analysis and reporting. So the main skills, as I showed in earlier slides, you have to develop in our SAS, survival analysis, regression modeling, and whatever it is, you have the deep understanding of public health context. That's more important. And as an epidemiologist, you have to investigate the pattern, cause, and effects of health and disease conditions in population. So during COVID-19, the epidemiologists are the one who, led the charge in outbreak investigations, contact tracing models, risk communication. And yeah, so there are certain, the National Institute of Epidemiology under ICMR trains some field epidemiologists, and Public Health Foundation of India runs the MPH program focused on epidemiology. And epidemiology closely works with WHO, India, Ministry of Health, and state health services to combat both the infectious, non-communicable disease. And yeah, and then the final one is going to be the health data analyst or scientist. So they are going to blend the statistics, domain knowledge, and programming to extract insights from health data. So the health data is going to support the hospital administration, insurance analytics, or a digital health startup. So whatever it is. So as a data scientist in health, apply the machine learning and the artificial intelligence for the clinical decision support, predictive modeling, and precision medicine. There are many startup ecosystems like Practo, PharmEasy, LT5Me. So predominantly many data scientists have been employed there, and many hospital groups like you have got Apollo, Fortis, Narayana Health, where they are using many statistical models with the help of the statisticians, and even several NGOs and research organizations. So, of course, you need to have, skill and strength you have to develop for, our Power BI, Tableau, or Python, SQL. So it's just like an extra learning kind of an, statistical programming. So yeah, so that's the one thing. And I have heard from few of my friends, like when I was studying, like a few of my friends are from Kerala, so they used to say like they can get the internship and fellowships at ICMR and other certain organizations, and they also like contribute to open source health data projects. And you can also like join the online communities like R for Public Health, DataKind, and Health Tech Hackathon. So there's certain things where you can really fit in and you can try your hands. And then comes the challenges and ethics. That's again one of the key things where you need to keep these things in your mind. The most important thing is going to be like as you go deeper into the biostatistics, it's important to acknowledge it and acknowledge the responsibility that comes when handling the health data. So the first one is going to be the data misinterpretation. most common thing is misinterpreting the statistical results. For example, correlation and causation. Correlation doesn't imply causation. Just because two variables move together doesn't mean one caused the other. A small p-value doesn't always mean the result is clinically important. So when these are certain examples which we always, misinterpret. So in a public health, if you're going to interpret something wrong or poor interpretation, then probably that can lead to unfounded panic or ineffective policies. So if these can, mislead some of the things. So as a future professionals, students must be, you have to train yourself, like question the data assumptions, whether our assumptions are perfect. You have to understand the context before you give some conclusions. Communicate the, the findings accurately to a non-technical audience. That's more important. Okay. So the dashboard which I showed you is not only viewed only by a statisticians. It is by anyone who really wants to go and look out what's happening. So it has to have some meaningful thing and it's easy to communicate. So that's the most important thing. And then comes the statistical manipulation. So sometimes, like statistics are intentionally misused to support a biased agenda. This includes like practices like cherry picking data, like what you really wanted to, you will just pick only those data. That's something wrong. P-hacking or changing the endpoints after the data collections. So in an industry with unfunded research, there is often a pressure to provide a positive result, especially in clinical trials. So a pharmaceutical company might suppress studies to showing the adverse side effects, distorting the evidence base. So this will highlight the need for transparent research practices, peer review, and reproducibility. So now, when you look at the Kerala health data sitting on a global platform and it's for a public view, that should be give a right information. If any of the data which is sitting there is going to give a wrong information during the pandemic, everyone will have a panic. So that's why you have to be very careful. And you have to have go with the guidelines, ethical guidelines, like the bodies, like what ICMR is saying, AIMS is saying, WHO is saying. So you have to have that. So the privacy and ethical concern is another one. So health data is deeply a personal one. You're going to protect it. It's a critical one. So patient records, genetic data, and health histories must be handled with confidentiality. Unauthorized sharing or poor data security, that's a privacy breach, which you shouldn't, sell it. And that's why the Aadhaar linked health data that raised concern, right, around the surveillance and the data misuse. So who owns the data? Can patients opt out of the large public health data sets? So those are something which we always think. So what I wanted to say is final thought. As a biostatistician and an analyst, we don't just work with the numbers, we work with people's life behind those numbers. So the ethical integrity is also an important technical skill. Okay, just in a couple of slides, so I don't want to prolong for a long period. The future of biostatistics, as I showed you earlier, the real-time, dashboards, AI-time dashboards. So yeah, it's an analyze the complex health data set much faster than the traditional methods. So biostatistics will provide a foundation for training AI models, data cleaning, selecting the variables, evaluating the model. It's now used for early disease detection, predictive diagnostic, clinical decision support. And yeah, so those are something which is important. And real-time dashboards, as I showed you, that's really crucial for decision making, and that will visualize the current numbers, recovery dates, the testing data, the vaccine coverage, so whatever it be. So they use the real data streams and statistical models to guide the public response. And if you could see, there are some kind of an app which is available which was available in here, the Arogya Setu, the mobile app that used to contact the tracing and risk scoring to alert the users of exposures. COVID, that's another India's vaccine management platform, which showed state-wise vaccine availability, bookings, and dose coverage. So these were something robust data infrastructure along with real-time analytics and visualizations, where the biostatistics played a crucial role. I know like you would have heard these things, but I want you to relate with biostatistics. And then everybody are aware of the smartwatches, the wearable and personalized medicines. So devices like smartwatches, fitness bands, so they are going to have generate and continuous health data. So you get heart rate, sleep cycle, glucose levels, and everything, right? So that's going to be like analyze the longitudinal and eye frequency data. It's going to shift towards the personalized medicines based on your kind of a lifestyle and everything. So yeah, so those are something which is like driving us. Wearables are being used in studies for cardiovascular risk, and startups are trying to integrate the wearable data within AI to manage the chronic conditions. So the main takeaway, what I wanted to emphasize is these advances show how biostatistics is no longer confined only to one kind of a research publication or academic journal or a lab report. It's going to be heart of the digital heart transformation. You want to drive decisions, saving life, and shaping the policies in real time. So what is my main summary and the key takeaways of my last 45 minutes? I hope like I didn't make everyone like in getting them back to sleep. It's a Friday evening, so I don't want to dose you off. Yeah, so to wrap up, I just wanted to leave you with simple but some of the powerful message. Biostatistics is not merely numbers, but it is the backbone of the modern healthcare. Why it is going to matter? It's a science that powers public health decisions from vaccination strategy to maternal health policies. It guides doctors, hospitals in understanding the effectiveness of the treatment, safety of the patient, allocation of any resources. It also drives research breakthroughs from survival of a cancer to personalized medicine and ensures health systems are equitable, efficient, and most importantly, evidence based. Okay, so these are something which I really wanted to put out. And real world impact in India, you can go and look like the Family Health Survey, ICMR, COVID, Arogya Setu, or the Cancer Registry, all are using the biostatistics at their core. And as I showed you the dashboard, you can go and look like how their epidemiologists and the skilled analysts have how they have worked behind the scenes. And there are a lot of growing, opportunities for you guys, for biostatisticians and public health analysts. You can be a data scientist, you can be an epidemiologist. When India is having a growth with health space, I think this is more important. A final thought, whether you're from statistics, life science, engineering, or medical background, you can play a key role in shaping the future of healthcare. With the right tools, ethical mindset, and curiosity, biostatistics will offer you not just a job, but a chance to make a meaningful impact in people's life. And finally, I can now put it for the questions and discussions. So thank you all for being a thoughtful audience today. I hope this session give you a clear picture of how biostatistics is shaping a modern healthcare, especially in India. Now, I would love to hear from you. So if you have any questions about the topics we discussed or a general talks like what could help me to learn these courses or something, you can just start asking me. Else, like I can share you my email address. Probably like we can do that even after the session.
Dear participants, if you have any doubts or queries, you can ask it in the chat box.
Gautami, if there is not much queries, let's finish. I think it's Harini is almost 1:30 there.
Okay. Okay, sir. Okay, sir. So thank you so much, ma'am. That was a very fruitful session on biostatistics. I think everybody could benefit from it. So for the official vote of thanks, I invite Ms. Vijayalakshmi S., research scholar from the Department of Statistics, St. Thomas College, Thrissur.
Good evening, all. It was truly an insightful session by Dr. Harni, and I believe that all of us gained a valuable knowledge about the role of biostatistics in modern healthcare. On the behalf of all the participants and the Department of Statistics, I express heartfelt gratitude to Dr. Harni. I also thank all the participants for your enthusiastic participation. Thank you.
Thank you, Harini. It was wonderful, and good night, sweet dreams.